Good afternoon, everyone. I'm Subhash, and it's given me a great pleasure in welcoming Dr. Noel Somasundaram and all the others on the webinar on diseases on modern times by Dr. Noel Somasundaram. And let me give a brief introduction about Dr. Noel Somasundaram. Dr. Noel Somasundaram is a consultant endocrinologist at Diabetes and Hormone Center, Colombo. He was the lead endocrinologist, diabetes and endocrine unit at National Hospital of Sri Lanka from 2004 to the 2020. Currently, he is the president of the South Asian Federation of Endocrine Societies. Dr. Somasundaram completed his medical degree at University of Jaffna with 7 gold medals and including the best performance in the final MBBS examination. He was also awarded the best performance in MD examination in the year 2000 by the University of Colombo. He was also awarded the ZES Prize for the best best poster presentation at the Clinical Cases Meeting, Society of Endocrinology, UK, February in 2004. And best oral paper at the Velu Winter Symposium in 2007. And also the best oral paper at Sri Lanka College of Endocrinologists annual sessions in the year 2014, and the best poster paper in Sri Lanka College of Endocrinologists in the annual session in 2014. Dr. Noel Somasundaram held membership and honorary posts at the Specialty Board for Endocrinology, Postgraduate Institute of Medicine, Sri Lanka, Sri Lanka Diabetes and Cardiovascular Initiative, Sri Lanka Diabetes Federation and Endocrine Society of Sri Lanka. He has completed 140 publications until date. His innovations are the introduction to the catheter studies for endocrine disorders, comprehensive pituitary disease management, and comprehensive obesity service, diabetes service at National Hospital of Sri Lanka. If there is any questions, please post in the chat box. Doctor will answer for those questions. Sir, it's over to you. Thank you.
Thank you, Subhash. Ladies and gentlemen, it gives me great pleasure to talk to you all on a topic that is very relevant to all of us, each one of us. It will be relevant to you and your families, and I'm sure you will be able to pick up one or two things that you would take from here as take-on messages. So without wasting your time, I want to talk about these diseases of the modern times. If you look at what has happened over the past century or so, we know, first of all, that the life expectancy of people has started rising exponentially. So starting with the end of the Second World War, we have seen that the average life expectancy, which had been about 40 years for a newborn person, now it has gone up to 77 to 78 in Sri Lanka, and across the world, we also see this similar rise happening. This has been owing to marked improvement in life conditions, particularly sanitation, which had resulted in decrease in many of the then untreatable conditions like diarrheal diseases and respiratory conditions, which had killed a lot of people. And then conquering malnutrition, which had been a problem for societies. And we also now see that complicated conditions like cancers also can be treated reasonably well. So we have achieved a lot in the modern times. However, we see that this is a society or generation for the first time in the history of mankind, where the children being born have lesser life expectancy than their parents. Why do I say that? Now, we have kept on saying that over time, the life expectancy has kept on rising. Now we are saying the newer generation will probably live less long than their parents. Why is that? This is due to a sharp increase that we see in these 5 conditions that I have listed in the slides that you are looking. Obesity, diabetes mellitus, high blood pressure, heart disease and heart attacks, and the metabolic syndrome, a cluster of multiple risk factors like overweight, high cholesterol, and high blood pressure put together we call metabolic syndrome. So even if you don't know all the technical details about this, if I ask you how many of you have seen at least one person with this condition, you know that it's all around us. Overweight, for example, 2/3 of Colombo population are overweight. If you look at diabetes, you will see a similar diet picture. So this was one of our studies that we had done a few years ago in Colombo. And there we have looked at 3 age categories. You can see 18 to 40 years, 41 to 60 years, and more than 60-year category. And what you see is in red is the percentage of people in these age categories in the society. These are not in the hospitals. These are people who are living in their homes. We have gone to homes and invited them to do a test. So you can see that 18% of all under in the 18 to 40 years had diabetes, and it steadily rises to 41% in those over age of 60. We know that diabetes increases with age, but you can see in this whole cohort of about 3,000 people we studied, 2/3 actually had either diabetes or pre-diabetes, which had been shown in yellow bar here, leaving us with only 1/3 of the population who have no glucose abnormality. So if you look at Colombo population, this becomes a problem. Now this study, as I said, was done about 5 years ago. Now another colleague of mine had looked at the similar data in another population in Colombo, and it seemed to suggest that a large number of population of Sri Lanka, and across Sri Lanka, if you look, lots of people are developing diabetes. And if we saw overweight, you can see by age or by gender, by male, female, you can see that 2/3 of the population are overweight and obese. There are many ways to look at the world, and one way is to look at it in a representative sample. So, for example, if you look at the wealth of the world, we know that the Northern Hemisphere and the Americas have most of the wealth of the world, whereas the rest of the world are relatively poorer. The opposite is seen if you look at the diabetes map of the world representatively. And you can see suddenly the poorest parts of the world are now the most rich places for diabetes. So much so that our South Asian region carries 25% of all diabetics in the world right now. So why this rise? That I will pose a question to you to think through why poorer nations are getting more diabetes. So if you look at the new order of things, we can see that the fatter new world is taking over. Our children are growing fatter. You can see that all around our society, we can see that. And in the over time, people tend to gain both men and women, actually more commoner in women, although I have put the picture of men. The visceral fat, that visceral means inside the organs in our body, there is fat accumulation, and that is why people get this tummy enlargement. Lots of people worry about it, and you can see the amount of fat which is given in yellow color here, increasing over age. And here we see a cross section in an MRI scan of a person who is normal on your right side with very little fat, you can obviously see, and the same yellow color deposition in an overweight person where there is enormous amount of fat around the heart, around the body, around the peripheries, in the legs and so on, but mainly in what we call the central area or the trunk of the body. Below the neck up to the hip is where most of these fat is being accumulated. So we are becoming fatter and we are becoming sicker because of these new illnesses. And that is why I said the newer generation will have more illnesses than in the past, and therefore a shorter lifespan can have been expected due to the modern trends in the sanitation and advancement of science and so on. So if we look at the reason why people are becoming fatter, you know that there is always a balance between energy consumption, which is energy intake, and energy expenditure. So those two factors are simple ways to understand why somebody would have excess energy in the body, which will then be stored as the fat, as I've shown you in my diagram in the past. So what has happened to us? We have started consuming more energy dense foods and more high calorie diet foods. For example, if you think of all the foods that you have eaten for the last 1 week, you will realize that it is rich in fat, it is rich in salt, it is rich in carbohydrate, and has less fiber and less vegetable. On the other hand, if you look at your last week and ask how many kilometers you have walked or how many steps you have climbed, you would realize that despite the lockdown and what was possible, you would realize that the energy expenditure in our day-to-day life has become lower and lower. So we have become sedentary in our lifestyle. Everything is mechanized. Even when we go out, we usually use a mechanized transport rather than being mobile on our legs. So this has resulted in less energy requirement for the body, but on the other hand, more energy intake. So that results in the pendulum swinging towards obesity, and the obesity causes all these diseases, as you can see. So obese individual is likely to have lots more conditions and has less life expectancy than the others. So we know that big three cardiovascular disease, including heart attacks and other high blood pressure and so on, and diabetes are commoner in individuals who are overweight or obese. And we also know that osteoarthritis is because of this excess body on the upper body, the lower joints, the hip and the knee and the foot, which carry the weight, suffer as a result. We also know there is gallbladder stones are common in fatter people. Cancers, 80% of the cancers are attributable to lifestyle factors like lack of exercise and unhealthy foods and overweight. So that again is a major risk factor that we are looking at. So if you look at Sri Lanka is famous for many things. For example, we are number one for our tea and number one for our hospitality to strangers. But if you look, we also lead in other ways. We are infamous for many things, including for the cardiovascular death rates, which is attributable to diabetes, high cholesterol, and high blood pressure. These three things I keep talking about because they are the number one causes of death in our society. And we know that 2/3 of the deaths are caused by the combination of these three, causing heart attacks or strokes. And we are number 5 in the world for the rate at which people get cardiovascular disease. We are also among the top 10 for diabetes prevalence. We are number 1 for diabetes prevalence in the South Asian region. And so we are infamous for many things. So just to illustrate what I've been saying, and just for us to discuss a little bit of a new angle to the health, I want to talk about this person. I'm fictionally calling him Mr. X. Although I'm using the word fiction, this is a day-to-day event in doctor's life in Sri Lanka. So let me introduce you to Mr. X, 32 years old, a healthy executive. He's healthy. He visits his doctor for health check. His blood pressure is 120/80 being the normal, just marginally high, but the doctor would reassure him saying, it's all fine, it's just marginally high. His cholesterol is 200, his HDL is a bit low, his LDL is a bit high, his triglyceride is a bit high. So they are all marginally abnormal. They are not perfect, but they are marginally abnormal. If you look at his weight, he is a bit overweight for his height of 5'11", where his weight has to be 72 kilos. He has got 12 kilos of excess weight. So that 12 kilos would have normally come from fat deposition, mainly in the trunk and mainly inside his abdomen, which would have resulted in minor increases in blood pressure and cholesterol. And if you look at his fasting plasma glucose or blood sugar, you see that it's borderline, it's 100. It's nothing wrong, but it's not normal either. It is not less than 90 as a 32-year-old gentleman should have. So healthy, fat, slightly high pressure, slightly high cholesterol, not so normal blood sugar. So as most doctors would say, he would not require any treatment, but he would require his weight to be watched and maybe cut down fat, reduce salt, and glucose levels to be monitored, reduced. If he was smoking, he would be advised to stop smoking. So these are the advices he would receive. Time goes, these conditions don't hit you all at once. So 6 years later, still being healthy and fine, he suddenly develops chest pain. This is a story that we as doctors see on and repeatedly on and off. And when we did when ECG was done, he's found to have a massive heart attack in TDMI. So while being treated, like any other person, he would ask, if the doctor told me that I was normal, how did I develop a heart attack? Could I have done anything at all to prevent this? I think these are the two questions that I would ask you to think through, to ask, because I've said heart attacks are the #1 causes of death in Sri Lanka. Whether you can do anything about that to live a healthy life. So if you look at a cross-section of an artery, blood vessel that supplies the heart, actually when you get a thrombosis on that or blood clot on top of the cholesterol plaque, and it blocks the blood flow. So what is in red here is the blood flow you can see. If it gets blocked, you get a heart attack or a stroke. And so that is what happened to him. But if you look, you can see from first decade on to second, third decade and to the fourth decade, the heart attack or a stroke is something that we earn, we work for it. Why do I say that? At birth, we know that the arteries are fully open, and yet in the 5 years onwards, if you look at Sri Lankan children, you get the early deposition of cholesterol called the foam cells on the arteries, and which becomes streaks, which becomes a lesion, as you can see here, and atheroma, where you can see fresh cholesterol within the atherosclerotic plaque, as we call it. It becomes more organized, sometimes gets calcified, but usually is a healthier but more narrower blood vessel, because there is lots more cholesterol deposited there. And one day, when it becomes unstable and the blood clot sits on that because of the injury over that area, you get a heart attack. So when I say a heart attack is not a sudden event. It has been earned and worked for through the life. It's an acquired condition. It's not something that happens like a lightning strike. We could have predicted and done something to prevent it. I'm not being wrong. So when I say, a heart attack is preventable, I'm being very truthful about this, as you can see. So as mistakes found out, the best way to deal with diseases is to prevent them. It's not to treat them once you've got a heart attack and has nearly lost your life and have been resuscitated and stented or bypassed in order to live further. It's actually possible that this stage of advanced stage of heart disease could be prevented at early stages. And you can see that this has been earned from birth onwards, from the time you come on this earth, from the way we live our life, determine when and whether we would get it. So prevention is the word that I wanted to talk about today. In the rest of my time that I have is to talk about prevention strategies. Can we prevent heart attack? Can we prevent cholesterol from going up? Can we prevent the blood pressure from rising? Can you prevent diabetes from happening? Because I've said all around us and within our families, we are seeing a rise of this problem of these diseases of the modern times, the overweight, the high blood pressure, the high cholesterol, and so on. So in any prevention, we do primary, secondary, and tertiary prevention. So for example, if you take that to COVID, which is the fancy topic nowadays, primary prevention of COVID includes getting vaccine on time and wearing a mask and practicing SMS, which is social distancing, wearing a mask and sanitizing your hands and avoiding mixing in crowds and with possible people, even your friends who could carry the COVID. It's primary. If you translate that to heart attack, you know that you can prevent the development of a risk factor, diabetes, high cholesterol, high blood pressure. These are the ones that accelerate the deposition of cholesterol on your arteries. And if that can be prevented by primarily acting on it even before it has occurred, then it is primary. Sometimes, even when you have worked hard for it, you might still get those conditions because of multiple other factors, say genetic factors, say the stressful life that you go through. You might still get one of those. If you control them and treat them properly, then it is called secondary. Say you develop diabetes and you treat it properly, it is called secondary prevention. In keeping it under control, if you have got high blood pressure, treating high blood pressure with tablets and salt reduction and increase in exercise and better diet is secondary prevention. You've got it, but not at a late stage. You can still do something about it. If you haven't worked for it, you will get a heart attack or a heart failure, and then you can do tertiary prevention, which is damage control. So you've got complication of diabetes or high blood pressure or high cholesterol, and then you go through rehabilitation methods, do a bypass, do a kidney transplant, or take medication for the kidney to get better. That is called tertiary prevention. So at the later stages also, you can lead not normal life, but reasonable life by exercising tertiary prevention. So it's best to do primary prevention, that you don't get anything at all, but you work towards that from your childhood. You've got the disease or risk factor, and then you control it properly, is called secondary. You've got a complication, and then you work towards mitigating the effects of that on the body and perhaps the chance of death from that complication can be decreased by certain specific prevention methods. So World Health Organization says these three are the secrets to health: eat less, walk more, and don't smoke. I think that kind of captures the way to prevent 80% of the diseases that we get. High blood pressure, diabetes, heart attacks, strokes, cancers, 80% of them, all including cancers, can be decreased by these three principles. Eating less than what we do, because research shows that most people, even in Sri Lanka, eat twice the amount they require. So cutting down foods like carbohydrates, starchy food, and sugars and alcohol is one way to live healthy. Walking more. A living human being should walk at least 6 kilometers a day, and children should be running it rather than walking it. And so if we can all do that, then lots of diseases can be prevented. It also improves mood, it improves memory for children who study. So we were taught, for example, when we were children, to even do exercise on the day we were going to go for the exam, which I carried out even during the medical school. If you all exercise, the brain works better, mood is better, but also non-communicable diseases, the diseases of the modern times, can be controlled. Smoking, of course, I don't need to say anything at all, because lots of research repeatedly shows that the effect of smoking is cancer and heart attacks, and those two can be prevented by just kicking the habits. So just want to take a few words to take diabetes as an example of primary prevention and secondary prevention, and then I want to wrap up for you to ask any questions. So if you ask what diabetes is, the answer is to think of a lock and key mechanism, where if you liken the cells and the body tissues to a lock, which need to take in glucose for them to use the glucose as fuel. The insulin is the key that opens that door to enter glucose, for the glucose to enter into the tissues and the cells for fuel as fuel. Now, if you have any problem, either lack of insulin or resistance, that is, the insulin is there, but it's unable to open the door to allow the glucose to enter, you have more glucose accumulating in the blood, which results in damages to all of the tissues, including eyes, kidneys, nerves, etc. That is what is diabetes. So although we diagnose diabetes by blood sugar, it is only the sign or the symptom or the symbol of a greater problem that is occurring. Because the high glucose causes damage to, this is the picture of a retina where there has been bleeding and fibrosis, which will result in blindness. Number one cause of blindness in Sri Lanka is diabetes. And here I have shown the blood vessels of the heart, which get aggravatedly or accelerated deposition of cholesterol occurs in diabetes, causing heart attack and heart failure. So for heart attacks, 2/3 of the heart attack in Sri Lanka are caused by diabetes. And then kidney disease for diabetic, for kidney failure, diabetes is the number one cause in the country. And foot ulcers on the foot. You can see these abnormal large ulcers like this that don't heal, that result in amputation is because of diabetes. And amputations, the number one cause of legs being removed in Sri Lanka is actually diabetes. So it's a multi-system disorder. So if anybody thinks, look, my sugar is slightly high, let me take medicine when I get symptoms, the first thing that most people notice is one of these four: either problem in the nerves of the eye, or a heart problem, or a kidney problem, or a foot problem. So diabetes doesn't, blood sugar itself rarely causes symptoms. So if you look at these three complications that I showed, retinopathy, which is the eye problem, the kidney problem, and nerve problem, you can see based on duration of diabetes, the complication rate rises. So if anybody thinks, look, I'm going to live with diabetes until it causes me problem, then I will go for treatment, you have thought wrong. Because if you see diabetes more than 20 years of age, almost everybody has a nerve problem. And almost everyone, 57% has a retinal problem, and 25% have got kidney disease. So diabetes, over time, you can see as it's diagnosed, very few have the condition, but over time, diabetes results in these complications. So who are at this risk of diabetes? A family member having diabetes is a strong risk factor for diabetes. Being South Asian itself is a good genetic risk factor that causes diabetes. Overweight is a sure way to get diabetes, and similarly, losing weight is one sure way to get rid of the risk of diabetes. Those who are inactive or sedentary, those who don't do exercise adequately, or are seated most of the time, or are sleeping most of the time, as you find in COVID times, are at risk of diabetes. Because a human being is supposed to be an active animal on our feet, and we are supposed to walk around the earth every year. I don't know, during your lifetime. So you are supposed to walk 6 kilometers, which becomes into 400 times, about 25,000 kilometers for a year, and that roughly is the distance around the Earth. So I suggest to you, having scared you a bit and having spoken about these problems, but I haven't exaggerated. I have only spoken the truth about what happens in Sri Lanka and what happens in our lives and in our families. May I suggest to you 5 small steps that will give you big rewards? Because as I said earlier, 80% of what happens to us is preventable. Isn't it great to be able to have a healthier life by doing simple things and simple steps during our lives? I think that's a great opportunity for people to take it on and do it. Number 1, if you know how risk your own one is, and then it is easier to manage it better. So estimating your risk. So you can see this cardiovascular disease or heart attack risk by looking at your blood pressure. The higher it is, the higher the risk, because red means higher risk and green means lower risk. And age, as the age rises, it goes up. And then with diabetes or smoking and with other conditions like cholesterol, your risk goes up. So somebody who is more than 65, who has high blood pressure, diabetes, has almost 25% risk for heart attack within 10 years. Whereas somebody who doesn't have blood pressure, who is younger, who has no diabetes, has almost zero risk of getting a heart attack. Similarly, you can estimate the risk of diabetes, and you can see at the points here, if you have more than 10 points, you have higher risk of diabetes, and you can see age more than 65 gives you 9. I will get you to work it out. Most people are overweight, so if you are overweight, you get 5. Do very little exercise, have 5. If there is somebody in the family with diabetes, you get 1. If both your parent and one of your siblings have, you get 2 points. And if you are a lady and you have given birth to a child more than 3.5 kilos, you have 1 point. As you can see, most people easily get 15 points in this. Even if you are young, you can see how easy it is to get to these risk factors. So increasing age, increasing body weight, doing very little exercise, family history are sure ways in which diabetes comes to you. If you have high risk, you have to do a blood test in order to check your blood. The other thing to estimate your risk is to ask whether you have any one of these, whether you are overweight, whether you have high blood pressure, whether you have high cholesterol, whether your liver test SGPT is high, and your behavior of smoking can also identify. So we said there could be multiple risk factors in your diabetes or other conditions. Do you have them? If you have them, can you do the second step, which is to set some targets? If you're overweight, for example, I'm going to lose 1 kilo every month for the next 1 year, will give you 10 to 12 kilos of weight loss. So these steps, as I say, doesn't have to be giant strides. They can be simple steps that you do, which will have a major bearing in your health. So for example, here you see intentional weight loss and reduction in mortality. So you can see obesity-related cancer, which I said is most of the cancers we see in Sri Lanka. A loss of weight by about 10 kilos gives you a 50% reduction in cancer and 15% reduction in CVD. And all-cause death, this mortality means death, mind you, all-cause death from any risk factor could be decreased by 20% just by simple 10 kg weight loss. A diabetes-related condition like kidney failure or heart attack could be decreased by 45 to 50% by 10 kg weight loss. Actually, one sure way to get diabetes better is to be able to lose weight. So do you remember those steps that I said? Estimate your risk is the number one thing we said. And number two, can you remember? Set some targets. Lose weight. I'll start walking. I'll start changing my food like that. So those were the step two. Number three is to change the way you eat. What do I mean by that? Lots of us eat lots of unhealthy foods. And in general, if you are somebody who eats a lot of processed or restaurant cooked food, your risk of illnesses is high. So if you can change to healthier, more vegetable, more protein type of diet, you're going to be way better. Step number 4 is to start exercising. If you are older than 60, just simple walking would be fine. If you are younger, I suggest that you think something more strenuous than that. But start somewhere and build up gradually. You may not be able to run a marathon in one day, and I don't require you to do that because 1 hour of exercise is good enough even to lose weight. And if you can walk 6 kilometers during that time, that's well and good. During lockdown, may I suggest that you think about some indoor exercise. An excellent indoor exercise is to stand on the same place and to walk. Just move your legs and stand on the same place and walk, which is an excellent way to do exercise during lockdown. Another way to start exercise, which is even more interesting, is to go to YouTube and ask and search for 60-minute workout. You can also find some in my website, diabeteshormonecenter.com, but you can also find a lot of useful free videos on the YouTube if you can search for 60-minute full body workout or just 60-minute workout. And then play that and repeatedly do that daily. Don't give up even if you can't do. If you can at least start with half an hour and keep increase, it will be great because people who have led a sedentary lifestyle and haven't exercised may feel very faintish, may feel short of breath, may have lots of problems as you start, cramps and pains. Don't give up. Start wherever you can and keep increasing. The thing is to not stay there, but to keep doing. So my final fifth point is to get your family involved. Because as I said, a single person may not be able to do that because there are lots of things that here that are required as a community or as a family. For example, the way you eat, the way you exercise. What about the risk to children? Are they, if the parents have these risks, the children are also at risk. So think of the children, because as I showed you in my diagram of that artery, even children as young as 5 years have atherosclerotic plaques. And the way our children live in a secluded, sedentary lifestyle, you can imagine, Dave, if you are getting a condition at 40, children will get it even earlier than that. If you have any of these conditions like obesity, diabetes, high blood pressure, and lipids, think about treating them properly, because if you treat them well, you can prevent complications. So, ladies and gentlemen, we've come to our last slide where I would like you to take these 4 points home. Modern lifestyles, I showed you how they have increased many diseases that are what is called the modern disease of the modern times, like the diabetes, high blood pressure, cholesterol, etc. Exercise, diet, and smoking also are important determinants of this risk. Actually, it's primarily the way we have chosen to live without exercise, with too much food, and expecting us to live healthy. Despite all that is why we have got to this stage as a community. There are multiple levels of exercise, primary prevention being best. As I showed you, and I showed you 5 different things you can do to mitigate those risks. For example, changing the way you eat, changing the way you exercise, stopping smoking, setting some targets to weight loss, etc., and getting your family involved. So these things are important for primary and secondary prevention. So at various levels, you can do it. Even if you have diabetes or high blood pressure, you can still control them with adequate drugs, as well as the important steps I spoke about. And finally, as I've kept on coming back, healthy lifestyle, plus knowing where you are, monitoring the risk factors, if you have diabetes, blood pressure, etc., control them, keep checking them. That is the best approach, because as Einstein once said, a prepared mind is the best battle strategy. So, ladies and gentlemen, thank you for listening to me. And as I kept on repeating, I will not stop being bored of saying that the best way to deal with diabetes, with diseases like diabetes, high blood pressure, cholesterol, obesity, overweight, is to prevent them, and that will give you a healthier life. So I will stop there. If you have questions, let's deal with them. So there are many questions here. One of the questions is about the food. Somebody has asked me which food is better, is it wheat or rice? You would have remembered when I spoke about carbohydrates as a whole. Let me tell you the research behind these recommendations. Now, how we decide which one is better and which one is worse is to ask what is the research behind. So both wheat and rice come from the same compartment of the food compartments, which is carbohydrates, and all of the carbohydrates, including yams like potato manioc or sweet potato or rice or wheat or grahan or oats are all digested to glucose when it is digested in the body. So they all give you glucose. There have been a big study at least, but many small studies that have looked at the effect of major food portion. So if carbohydrate consists of more than 60% of one's diet, like a typical Asian diet, you find that those people's heart attack risk, cancer risk, and diabetes risk is way higher than those who eat protein predominantly or vegetable predominantly. So I think I've given you a summary of what to do, which is to cut down the carbohydrate, whether it's wheat or rice or bran or other grains, but to increase the vegetable, because vegetable has other roles to play. Now, culturally, we are all used to a carbohydrate meal because in Sri Lanka it's easy to grow rice and it's cheap. We eat this cheap junk all the day. So when people are asked what food did you eat, they will first tell the carbohydrate of that: rice, bread, string hopper, pittu, whatever. The carbohydrate is the first thing you say, which is truthful, because the rest of the food items, the vegetable and the protein, which gives us the vitamins, the amino acids required to build our bones and our muscles, and for our brain to work, we need vitamins and minerals that we hardly consume, but we happily consume carbohydrate. So the problem is, because the carbohydrate is equal to glucose to the brain, glucose is supplied, and that becomes an addiction by the brain, because your brain repeatedly asks for the same thing. It's like a cigarette. Once you have one, the body wants more, because the brain gives you that signal. The same signal is given for glucose or carbohydrate. So once you get on it, you can't stop it. But the way to do that or cut down is to talk to the other parts of the brain. In the brain, there is what is called the satiation center, satisfaction center, where you've eaten a proper meal, the body knows, the brain knows, and gives a signal to the body saying, enough of food. And that habit change, as well as stomach becoming satisfied, occurs with increasing protein and vegetable, not with the wrong fuel, which is the carbohydrate. So the way to cut down carbohydrate is to start eating and is to fill your plate with starch and vegetables. So if 3/4 of your plate is with vegetable and protein, and the carbohydrate is cut down to less than 25%, then you will start losing weight as well. Somebody else has asked, what is the best food habits for sedentary lifestyle? Well, as I try to say, one thing that has happened in our history is that we have started cutting down the level of exercise, so much so that we are mostly seated. So the lack of exercise, you cannot compensate just by eating less. But so you need to also start exercising at least 1 hour a day, because human body is made to be engaged in activities throughout the day. So the best is to be active as much as possible, at least 1 hour, but the diet has to be matched to the requirements you need. So if you are gaining weight, that means you are eating too much. If you're losing weight, that means you're on the right track and that you are doing it. So the idea is to cut down the calories in the food by reducing all of the energy dense stuff like carbohydrates, sugars, oily foods. If you can cut down and increase vegetable and protein. I keep telling these two words, vegetable and proteins, because it's such crucial to a diet strategy by people. Somebody has asked an important question about alcohol and how much can be taken. The problem with cigarettes, as I've said, is that even 1 becomes addictive on the brain, and so your brain keeps asking for more and more. So we keep getting addicted to that. On the alcohol also the same thing can happen. So the best thing is, if you are not taking alcohol, is not to start it. There are recommendations to limit for a male to less than 3 units of alcohol, which is one shot of alcohol is 25 milliliters of whatever spirit that is consumed, or one glass of wine, one wine glass. The is to limit to less than 3 shots like that. But even at that level, you can become addicted. So therefore, best is not to take it. I think the questions are, another question is about hormone imbalance and whether it will lead to diabetes. Yes, many hormone overactivities like thyrotoxicosis, Cushing syndrome, etc., where there is excess cortisol, etc., can give rise to diabetes. Sometimes a hormonal imbalance may be associated with diabetes, like conditions in young women like polycystic ovary syndrome. Also, many hormone conditions are associated with high risk of diabetes. So, if you have a hormone imbalance, you would have heard about the importance of lifestyle changes with that. So that's true, and I've given you some tips on how to do that. So I think I led to that. I've answered most of the question. There is a more complex question about stress and lifestyle conditions. So one of the reasons why I've titled this topic as diseases of the modern times is our current way of living, which is driven by high adrenaline, which is ambition driven and more income driven, and where we work extra hours, work continuously, are willing to do a job and then a course and then sleep less, and sleeping late and waking up late, you find that each one of these is associated with diseases of the disease risk being elevated. For example, stress causes hormone imbalances, stress causes mental disorders like eating. Some people eat to compensate for stress, called stress eating, which results in obesity or abnormal weight loss. But we also find that the way we choose to live, where we sleep late, causes circadian rhythm, the body's sleep rest cycle to be broken, because you know that when your body is not a machine, even a machine has to be stopped on and off to rest. But a body has to go to sleep in order to repair, so that you don't get cancer, you don't get diabetes, you don't get other conditions. If you allow your body to repair itself and get rid of the abnormal nutrients and so on. But when we sleep late and are accumulating the sleep and are working on that, on borrowed sleep time, so to speak, you find that your body is actually not repairing, your brain is not fresh, your body cells are not metabolically repaired, but you keep on running. So that itself is an independent risk factor. Leave alone everything else, just sleeping late, even in children. Sleeping late alone is associated with hormonal imbalances like diabetes, polycystic ovary syndrome, etc. And the reverse is also true. If you can rehabilitate your body from this sleep lacking lifestyle to a healthier pattern, you find that diabetes gets better. It's easier to lose weight and your hormones become better balanced. So I think all of the questions in general I have answered. Okay, one or two more questions about carbohydrates being cut down and replacing that with fruits. Fruits are also sadly carbohydrates. So they are digested to fructose, whereas most of the starch, like bread and rice and all that, are converted to glucose. Fruits give you fructose, which is similar. So you will have similar risk if you are eating too much fruits. We can eat fruits, but in limitation, just like the carbohydrates. Are there any links between diabetes and fertility is another question asked. Of course, yes. Those who have subfertility and hormone imbalance, women in particular have diabetes or pre-diabetes and risks associated with that. If there is diabetes, the fetus can be affected, the embryo can be affected, therefore diabetes has to be controlled to a level where there is zero diabetes or no diabetes at all, and that has to be done. Another question asks, what are the best protein sources? Is it healthy to eat chicken regularly as a protein source? So all proteins are basically fish, meat, eggs, milk has rich source of protein. The vegetable plant proteins that are plant products that are rich in protein include soya and the pulses, the beans and the dal, the undu and those kind of pulses. So you find that those are richer in protein. So when they are taken at a higher level, the brain feels it in the appetite center, and you get satiated. That is, your body gets the signal that you've eaten adequately, but proteins are also needed for children to grow as well as for adults to repair their muscles and bones and others. And so for healthy diet, everybody has to have adequate amount of protein. Yes, they are, any protein is fine. You can mix it, you can change it, you can keep varying it as long as your protein source, like the chicken source, is reliable and they have not adulterated that with anything. You are fine. One word of caution: the processed protein. Now you find in lots of supermarkets, you find meat that is not sold as meat, but as converted into something else, like sausages or whatnot, bacon and all that. You find that some of them are not healthy because they have added fat and salt to that, but also your purity of that food product is questionable. So processed meat is not what I'm talking about. I'm talking about fresh, garden produced. When I say fresh, it could be frozen, but straightforward off the farm. So one more question is about fat-burning medicines to reduce body fat. Unfortunately, there is nothing that can make our body machine to burn fat more. The one way to make our body to burn the fat is to exercise. Activities, how it gets done. The various medicines try to suppress appetite or prevent the absorption or excrete the extra energy that is in the body. That is why these medications have so far been not very successful. Some do have their side effects. So the best recommended approach to weight is to tackle it with diet and exercise. Of course, if these are done properly and you're not succeeding, then you can go for alternative forms of therapy like medication. We even in very obese people do even surgery to get rid of the weight. But in general, I would recommend more than medication to target lifestyle from the beginning. Selvan, I have come to the end of the question, so handing you back to you.
Thank you, sir. Thank you for a very valuable, very informative and very useful webinar discussion with our staff members. It is highly appreciated and very useful for a healthy organization. And I take this opportunity to thank Subhash Rufiq for organizing this wonderful webinar, and our team, our webinar team within the organization, even with a short notice to pass the time and reminders for our staff to participate. I hope there are a few good message being passed by a doctor for a healthy lifestyle. And thank you, sir, once again. Thank you, everyone.
Thank you.